My name is Carol, and I'm here today to talk to you about depression. Depression is the leading cause of disability in the U.S. for ages 15 to 44. It affects approximately 14.8 million American adults. It's more prevalent in women than in men, with a median age of onset of 32 years. Only about a third of those suffering from depression seek treatment. Things that can contribute to clinical depression are biological, like neurotransmitters, cognitive or negative thinking, gender, co-occurrence, such as with cancer, genetics, and situational events. Symptoms of depression are persistent sadness, anxious or empty mood. The person can sleep too much or too little, have a reduced or an increased appetite, and difficulty concentrating. They may have a loss of pleasure, experience restlessness, fatigue, and irritability. Most important, the person may have thoughts of suicide or death. In this scenario, we're going to take a closer look at depression. For Jane, everything was going well. She had great friends, a fiance, and a job that she loved. It seemed like everything was going perfect.
Oh my God. Look at what just happened. I'm so excited.
Congratulations.
Thank you. I can't wait to start planning our wedding. Oh my God. And the honeymoon. Yeah, girl.
Where are you gonna go?
Oh, I'm sorry. That's weird. It's a weird number. I'll be right back.
Okay.
Hello? This is she. Yes, that's my fiance. What happened? Oh my God, I'll be there in just a second. Okay, thank you. Oh my God, something just happened. He was in an accident. I have to go to the hospital.
Okay, do you want me to take you?
Yeah, let's go. All right. Hi, my name is Jane. I'm here. My husband, John Doe. I got a phone call that he was in the hospital. Can you tell me, like, I need to know what's happening. Is he okay? What is going on?
Okay, can you first tell me your name?
My name is Jane.
Okay. And you're looking for a John Doe?
Yes, ma'am.
Okay, well, I'm not sure where he is right now or at the moment, so I'm going to have to call the doctor and see where he is. If you could just wait in the waiting room for me, I'll make sure that either I or the doctor will come out and see you.
Sorry, I'm so worried. Like,
I know, ma'am, I know. But
Okay.
I need you to stay calm
Okay.
and just go back to the waiting room, okay?
Thank you.
All right.
Oh my God, I can't believe this happened to my son.
Like, everything was so perfect. All I know is I got a phone call saying he was in some kind of car accident, and I went and talked to a nurse, and I haven't heard anything back about it yet, so.
They said that he was in an accident going to get the grass cuts for the wedding.
I know, like, everything was so perfect. It'll be okay, guys.
How are we gonna get through this? I don't know.
He's unresponsive. We're gonna have to call it. Time of death, 2:35. Did he have any family members here?
All I know is that there are some family members in the waiting room. I believe it's his fiance and his mother. So when you're ready to let them know, they're waiting.
Okay.
I wish they would tell me what's going on. Like, it's been hours. I should hear something by now.
Hello. Are you the family of John Doe?
Yes, I'm his fiance. This is his mother.
Hi, I'm Dr. Dreamy. Nice to meet you.
Hi.
We did everything we could for Mr. Doe, but we couldn't save him. I'm so sorry for your loss.
Oh my God, I can't believe this.
Oh my God, John, no. Please, no. I can't believe this is happening.
Jane suddenly finds herself alone in the world. An empty apartment where her and her fiance once shared. Instead of plans of a marriage and a family, she's planning his funeral.
I don't even want to do anything anymore. I hate my life.
At first, friends and family gather around to comfort her and help ease her pain. But as the weeks go by, she's all alone and she still has not returned to her old self. 2 weeks later, Jane can hardly get out of bed most days. She stopped showering and is not eating properly. She was dropped from her college classes because of unexcused absences. Friends are worried about Jane because she has not been answering their phone when they call. She will only respond to text messages by saying that she wishes she would just die so she could be with her fiancé.
I don't want to talk to anybody. Just wish I could be with John right now. Whatever.
Jane's best friend alerts Jane's mother about the disturbing text messages, and they decide together to get Jane to the hospital immediately. Jane is admitted to the psychiatric unit on suicide watch due to overdosing on pills.
Jane, what are you doing? Jane? Jane, get up. Jane? I need to call 911. I need an ambulance. My daughter's overdosed on some pills.
On assessment, the nurse will check for client's appearance. She's going to note how the client responds verbally, observe and check for physical complaints, assess behaviors and feelings.
My name's Whitley. I'm a nurse going to be doing your initial assessment here on the psych unit. Is that okay? Alright. Let's start. So Jane, do you have any thoughts of hurting yourself or hurting others?
I don't want to hurt anybody else, but I don't know, I wish I would just go to sleep and not wake up.
Okay. Okay, let's move on. Do you use any drugs or alcohol?
I don't use drugs. I might have a drink, like a couple beers once every few weeks, but that's it.
Okay, and by a couple you mean maybe 1, 2?
Two.
Okay. Do you have any history of depression?
I don't have a history. No.
Okay. Do you have a family history, such as a mom, a dad, a sibling maybe?
No, not I know of anything.
Okay. How about other mental illnesses in the family or with you? Okay. Alright. Have you ever gone through anything or felt anything like this before?
I've never lost anybody that's close to me.
Oh. Okay. Let's move on. Your support system. Family? Do you have mom, dad, close friends?
Yeah, I'm really close with my mom.
Okay.
My friend Jennifer.
Okay. Do you say you trust them?
I tell them everything
You go to them when you're upset?
most of the time. Yeah.
Okay. And the living arrangement. Do you live by yourself? Do you live with family?
I share an apartment with my fiance.
Okay. Now this might be difficult, but could you tell me what's recently happened to upset you this much?
He died in a car crash a few days ago, and
Since then, has there been any recent losses at job, school?
My grades have been falling ever since this accident. I haven't really been going to school. I took time off from my job and I never really went back to work. Just don't care anymore.
But before this, you were in school, you were going to work, had good grades?
Yeah, I was doing really good in school. I had a good job. I was always out doing stuff with my fiance.
Let me ask you something, Jane. How do you view depression? What do you know about it?
I'm not upset.
Okay. Do you find solace in anything, such as any spiritual? Do you go to church? Or any religious preference?
Yeah, I go to church every once in a while, but
Okay. So you find that helps you? Okay. Well, let's stop here for today, Jane. That's it. Thank you for your time and thank you, okay? You can go back to your room now. Alright?
Here are some nursing diagnosis and interventions for a patient with depression. First, they would be a risk for suicide as evidenced by history of prior suicide attempts. Some interventions can be to assess contributing factors by identifying the degree of risk or potential for suicide and seriousness of threat. You can also assist the patient to plan course of action to correctly deal with existing situation by discussing the loss the patient has recently experienced. You may also promote wellness by involving family to improve understanding and support. Powerlessness related to situational crisis. Some interventions can be to determine client's perception and knowledge of the situational crisis, assess degree of powerlessness experienced by the patient, noting verbal and nonverbal responses, and to provide positive reinforcement for desired behaviors. Ineffective coping related to situational crisis. Interventions can be to assess levels of anxiety and coping on an ongoing basis, encourage patient to try new coping behaviors and gradually master situation, and to develop regular exercise and stress reduction programs. Imbalanced nutrition, less than body requirements related to depression. Interventions can be to evaluate degree of deficit and identify deviations from the norm and establish baseline parameters. Can also assist in treating or managing underlying causative factors and establish a nutritional plan that meets individual needs.
Okay, so the next patient is Jane. It looks like she's here for depression and attempted suicide. So after I talked to her, she's been feeling really hopeless after her fiance died. She hasn't really been eating, crying. She wants to sleep all the time. And one of my concerns is her not eating. She hasn't ate in a while. So we're gonna go ahead and prescribe her Prozac, 20 milligrams POQD. We're gonna make sure she takes that in the morning.
Okay. Now it's Prozac 20 milligrams. PO
And then in the morning.
in the morning.
Okay, so the Prozac should help her increase her appetite, but it may give her some suicidal ideations. So just make sure you check on her throughout the day. Make sure she's doing okay and she doesn't have any suicidal ideations or she does not show any behaviors. So let's see. And she also has to attend group therapy. Make sure she's there. So you have the group therapy. And I know her mom and her friends are also involved. So if they come for visiting hours, you want to encourage that also. Do you have any questions?
I don't think so. Nope, I don't
Nothing?
think so.
Okay, so if there's any changes in her behaviors or if Jane herself has any questions or concerns, you can just let me know.
Okay, and what's her mom's name?
Her mom's name is Martha.
Okay.
Okay, sounds good?
Yep. Okay, here's your bill of file. Open. Alright. Next. Alright, here's your soda loft. Open. Okay. Alright, here's your Prozac.
Why do I need to take this? It's not really working.
It may take up to 1 to 4 weeks for it to work. We need you to take it, and hopefully it'll work.
It's kind of making me hungry too. Is that normal?
It is normal. It's one of the side effects, and that's good because you need to eat, and maybe it'll help your appetite.
All right.
Open. Thank you.
So thank you guys all for coming to group today. How are you guys feeling today?
Good.
Jane, how about you? How are you feeling today?
I'm feeling a lot better. I mean, I've been eating a lot more.
Good.
Been taking my medication as you had prescribed.
Good. Your Prozac?
Yeah, and I know they told me it would take a couple weeks to start working, and I'm feeling pretty good.
Good.
I've been really hoping to get back into school once I get out of here. And
What
I've
about your family and your friends? Have you been talking to them?
yeah, my mom came in here the other day, and I got to see her. So
Good. And does that make you feel better?
yeah, it makes me show that people care about me. So
And you feel like they're a good support system, right?
Yeah.
What about spiritually? Are your spiritual needs met?
yeah, I've actually been in communication with the pastor from my mom's church, and he said they've been praying for me, so that gives me some hope.
Good, good. That's good that your pastor has come by. Well, it seems like you're doing better. Do you feel like you ever have any thoughts of hurting yourself or?
No, I've been feeling really good.
Wow, it seems like you've come really far since when you first got here. I'm glad that you're feeling better.
Yeah.
What about you? How are you feeling?
Okay, I guess. I don't know. I don't really feel like talking today.
Okay.
Alright, Jane, well I see here that the doctors are ready to discharge you. How you feeling just before you
I'm
go?
feeling really good. I'm ready to get back into the normal life.
So you ready to get out of here and
Yeah.
start back to where you left off? Alright, that's great. So I've given you a list and a pamphlet of all the community resources that you can outreach to if ever you're just feeling that you need others just to understand or have somebody else to talk to.
Okay.
Make sure you're still sticking with group therapy. I think that really has helped you a lot throughout here, so
Yeah.
if you need any of those, we'll give you the contact information and when to meet, what works with your schedule. And then the most important thing is if you ever have thoughts of hurting yourself or hurting others, no matter what thoughts they might be sure to call. And I remember giving you the number, okay? And it's 1-800-273-TALK. discharged. And if you could just sign out for me, we'll be good, okay? And then one more paper, sign here that you received all your belongings. And then letting you know what your medications are when to pick them up at your pharmacy, okay? All right, you're all set, Jane.
So you're feeling better.
Yeah, I'm doing pretty good. I feel happy. I'm trying to get back in school, you know, just get my life back to normal. So,
You know I'm here for you if you need anything.
thanks. Yeah, I appreciate it. It was a really hard time. I can't believe everything that went on. But, you know, group therapy is really helping, and I've been taking my medication, and yeah, it's making me feel really happy. So,
Good, I'm glad to hear that.
yeah, thanks for being there.